Hey, it's Birdman, and it's time for another edition of Summit Healthcare's. I'm here in Angie Fabian's office at Summit Healthcare. Um, Joining me now, I have this wonderful lady. It is Avis Davis
Brown.
Brown.
Yes.
Awesome, very cool. Yeah, you made that easy for me name-wise, huh?
Yes, I did.
We're going to talk about your job here at Summit Healthcare, and you run the pharmacy. Is that right?
I do. I run the entire pharmacy department for the hospital, as well as I'm over the oncology center pharmacy. And we also distribute all medications that our physician practices offices need.
Wow, so that ends up being a whole lot of prescriptions, doesn't it?
Well, the physician practice groups is only what they dispense at the clinic. So if they're administering something, it's an office type of medication.
Okay.
So it's not prescriptions.
Oh, okay. So you don't deal with that. You just deal with the stuff. If somebody needs it, they come to you, you fulfill it. Basically, so there's just not a whole lot of drugs sitting all over the place, right?
Yes, at
Okay.
the physician offices.
Oh, very cool. In the hospital, what does that mean time-wise? How much?
Well, we operate 24 hours a day,
Mhm.
7 days a week, which was something new that we started when I got here. And that's been since 2013, so it took me a year to get that going. So we've been 24/7 since 2014.
Okay. What are the challenges in this position, especially being rural Arizona?
Well, the biggest challenge was trying to accommodate and get good pharmacists. I was only supposed to be here for 3 months just to get things started. And after 18 months, I I was asked to please stay,
Right.
and I'm still here since 2013.
You must be doing okay.
I'm doing pretty good. It's a challenge. I live in Phoenix, and I fly up here every week
Oh, wow.
and fly home. So that's how it goes to show you how much I like Summit.
So you're probably a really good critic of the airline services up here too,
Oh,
huh?
yes, I am.
Ah, good.
They know me by name.
I bet.
Yes,
Uh,
they do.
so talk to me about so it's 24 hours a day. So it means you always have to have a pharmacist on duty, correct?
Yes, we have 9 pharmacists total, including the oncologist pharmacists. And we have a clinical pharmacist that I rotate. So all my pharmacists are clinically astute. What we do is we monitor all of the physician's prescriptions that come through the pharmacy. We make sure that they're for the right illness. We make sure that we check for renal dosing. There's something that the CDC and the Joint Commission requires is that they want us to, it's called antimicrobial stewardship. So that makes sure you've heard about the superbugs.
I
Uh,
have heard about superbugs.
and
Okay.
this is what they're using to try to make sure that we don't have those superbugs so that we're not giving the big bang right in the beginning.
Right.
Because if you start off with the big bang antibiotic, you have nowhere else to go.
Oh, yeah.
And that's what developed these superbugs. So we monitor and make sure that we start off with the proper antibiotic and then we progress up.
So is what you're saying is that like I've heard them talk about antibiotic resistant strains. Is that what you're talking about with superbugs?
That is the
So in other
superbug.
words, the best defense is now not a defense at all.
Well, it's getting to that point because we have nowhere else to go because those bugs are becoming resistant to the best in that particular antibiotic group.
Yeah, and that's simply because that's how evolution works, right?
Oh yeah.
Yeah, they start to
Hmm.
figure things out,
Oh
and
yeah.
we get to the point where it's not going to be beneficial. So have you seen, and how long have you been in pharmacy overall?
30 years.
30 years. Okay. Have you seen a big shift or change, or has it been evolutionary as how uh, prescriptions or how drugs are used?
It's been evolutionary on the pharmacist role because the doctor used to have all the say. Now we have the opportunity to give them a call and suggest a different type of medication. Now, I won't say that goes well all the time.
Well, I have to believe initially it probably didn't go well at all, right?
Well,
And
I
then,
wouldn't say that. We've got great physicians.
no, no, I said initially,
Oh,
maybe
well,
way back when. None
way
of
way back when,
none of
yeah.
these people now. I'm
Oh no.
talking about, yeah, way back when. But then finally they started seeing some of the benefits or advantages
Oh
to it.
yeah. The program changed with pharmacists that they became more clinical. Now, you would find that most doctors they only get a couple of semesters of drug therapy. So they learn a lot of their medications from the sales reps. That's who they were getting their education from.
So the person selling the drugs would say, "Hey, you should use." Yeah, no, okay, I get it.
Well, now you see it on TV. How many commercials do you see on TV?
Yeah, a
Quite a
lot.
bit with the drugs.
Yeah, and
Hmm.
most of the ad is telling me about what the side effects are. But yeah,
And that's a scary thing. They've
yeah.
always been there.
Hmm.
But you ignore those because it's going to help you with this one thing.
Right. Okay, so talk to me then. So as you evolve this stuff and the pharmacists become more, like you say, clinical, is there a tie? Does the pharmacist get to know what works, knows not works? I mean, is there back and forth communication that's covered with the client or the patient?
Well, when we do, the clinical part of pharmacy, we are integrated with the lab. So we will know what type of ailment that they may have, and we know what drug goes with those ailments. And that the doctors do as well. But if we see something before they do, because we get these lab results quickly, we can jump on the front end and say, Doc, this is what we see. And could we please change this to an alternative drug? And that's what the pharmacist particularly does. And they do that all across the line. So if you're diabetic, we watch what insulins you're getting. We're starting a new program here at Summit where the pharmacists are going to be doing insulin dosing.
Oh wow.
Yes. So, we've got some new initiatives here at Summit.
Yeah, and then that obviously means they get additional training and the support and resources to do that.
Oh, absolutely.
Very good. Okay, is there something that gauges how well you do in pharmacy? I mean, is
Yes,
there
there is. There's always the Joint Commission. They
hmm
come in and they watch what you do regulatory, what you do clinically, your drug errors throughout the institution. There's administration. Are you handling the budget right?
hmm
There are many avenues that pharmacy covers. Are you watching your narcotics? That's a big one with the DEA. We certainly don't want the DEA coming in here. So I monitor all narcotics throughout the hospital.
Okay, so I know that there's obviously then there's indicator if you're doing bad, but is there indicators if you're doing well?
Oh, yes. There is a company that comes in and they go through what they call an operations audit, and it takes an entire week. They go through every facet of the hospital. And since I've been here, in 2014, Summit got Site of the Year, and this is out of 600 hospitals.
Wow.
uh, 2014, we received best practice, and you always hear about best practice behaviors. 2015, we implemented having a buyer. She received the Pharmacy Buyer of the Year.
Oh wow.
2015, we got the Best Practice Award again, and out of 100, we scored 97.7. So we've been on a roll here. 2016, we got Clinical Site of the Year, and we also received Best Practice of the Year at 97.8. So I went up 1/10.
Nice.
Yes.
Well, you can't feel bad about that at all.
Oh no.
Now you
Oh
said
no.
out of 600 hospitals,
Yes, I
and
work with a company. We're a management company for pharmacy, and they manage 600 pharmacies throughout the United States.
so they're all in different locations. Are they rural or are they
They're
mixed or?
they're all over. We even do the islands. We have Puerto Rico, St. Thomas, so just all over the
Mhm.
United States.
Very good. So what would you say about the staff that you work with? If you're
I
telling
have a
people about them.
miraculous staff. I think out of my staff so far, we've implemented something here at Summit called High Performers. and I've already had 7 people go through high
Oh,
performers
wow.
here at Summit.
That's very awesome. Cool. So it's good to know that then you have a good working relationship with the physicians.
Oh, yes.
You have a good work relationship with the staff. So very good. Anything final you'd like to tell anybody about the pharmacy?
The pharmacy is one of the best that they have. This is one of the best that I've been, and I've been around the United States. I think we have a great teamwork effort down in the pharmacy. We're family.
Awesome.
So if you're family, you get along. And one of the things that they know, you have to lead by example. And they know my word is everything. And they know that whatever it is, I'm going to go to bat for them and try to get the resources that we need to do the best we can for Summit.
Very good. So, Avis Davis Brown, one of the phenomenal people here at Summit Healthcare. That's going to be it for this episode of Summit Healthcares. Remember, you can follow Summit Healthcares on the podcast on iTunes and Stitcher, easily off your iPhone or Android phones. Very easy. If you want to go on YouTube, you can check it out with the Summit Healthcare YouTube channel. And there's a Summit Healthcares playlist you can follow. I'm Birdman telling you that we'll see you soon and be healthy.